Welcome to the deep dive. Today, we're plunging into something really important. Healthcare in nursing homes. It's getting more complex, right?
Definitely. Costs are up, the population's aging, and the pressure on these places is just huge.
And right there on the front lines, you've got certified nurse assistants, CNAs, and vocationally trained registered nurses, VTRNs.
Yeah, they're a massive part of the workforce in nursing homes, absolutely vital for resident care.
Which brings us to evidence-based practice, or EBP. We hear that term a lot. It's supposed to be key for better care, maybe lower costs, and importantly, making jobs more satisfying for these staff.
Exactly. But here's the thing. While EBP is, well, vital, it's not really standard practice everywhere in nursing homes yet, not fully embedded.
Okay, why not?
A big piece of it is that the tools we have for measuring or encouraging EBP, they weren't really designed with CNAs and VTRNs in mind.
Oh, right.
So for this deep dive, we're looking at a really interesting study. They actually developed a new tool. It's called the EBP Affinity Questionnaire.
EBP Affinity.
Yeah, it's specifically designed to get a handle on these caregivers' affinity, basically, how much they like, understand, and actually use EBP in their everyday work.
Okay, so that sounds promising. But let's back up. What was the core problem this study was trying to fix? You mentioned the tools weren't right.
Right. So you have CNAs and VTRNs doing all this direct, hands-on care day in, day out. But EBP, it's barely even mentioned in a lot of their training programs.
That seems like a disconnect.
It really is. And like we said, the existing questionnaires out there, they were mostly built for nurses with bachelor's or master's degrees. They just didn't capture the specific situation for these frontline team members.
So what can we expect from CNAs and VTRNs with EBP? Is it realistic?
That's a great question. The study points out different roles in EBP. There's the doer, that's someone who dives into the scientific literature, critically appraises it.
Okay, the researcher type.
Sort of, yeah. Then there's the user, someone who applies evidence that's already been checked out, like clinical guidelines, and the replicator who follows recommendations from experts.
Yeah. Right.
Now, CNAs and VTRNs, they are perfectly positioned to be users and replicators, following protocols, using best practice guidelines that fits their role perfectly.
But not necessarily doers.
Generally, no. Expecting them to critically appraise raw research usually needs, well, a bachelor's degree or a higher level of training.
Got it. So the study aimed to create a tool for their EBP role. How did they build this questionnaire?
It was a careful process. They used a mixed method approach, started with interviews, talking to experts to really confirm, what specific important roles CNAs and VTRNs can play in EBP.
Okay, grounding it in expert opinion first.
Exactly. Then they gathered a whole bunch of potential questions, like 77 items from the literature in those interviews.
Wow, it's a lot.
It is. But then they refined it. They had experts review it in 2 rounds, reach a consensus on the best items. Then they pilot tested it with actual CNAs and VTRNs.
Makes sense. So what does the final questionnaire look like?
It ended up being pretty concise, just 26 questions. It covers 5 main areas, things like taking a critical view of care and promoting expertise. And importantly,
Yes.
they used a simple 5-point scale, like strongly agree to strongly disagree. And crucially, they avoided jargon. The term EBP isn't even in the questions themselves, so it feels more relatable, less academic.
That seems really smart. So did it work? What were the results when they tested it?
Yeah, the results were quite positive. They tested it with 428 CNAs and VTRNs. What they found was a clear structure with 2 main factors emerging.
Factors, meaning?
Like 2 underlying themes the questions were measuring. One was about collecting practical information, looking up protocols, asking colleagues. The other was collecting theoretical information, maybe looking at professional journals or attending training.
Okay. And was it reliable? Did it measure consistently?
Extremely. Both factors showed excellent internal reliability. The technical score, Cronbach's alpha, was 0.88 for both. That's really high. It means the questions within each factor are measuring the same core concept very consistently.
Impressive. What about testing it over time?
Good question. They did retest reliability too, and that was solid. An ICC score of 0.76, which basically means if someone took the test again a short time later, their score would likely be very similar. So it's stable.
And did it measure what it was supposed to measure? That's validity, right?
Exactly, construct validity. And yes, it showed good evidence for that too. For example, people with higher education levels, like the VTRNs compared to CNAs, tended to score higher.
Which makes sense.
It does. Also, people in roles like first responsible carers or FRCs, often more senior roles, they also scored higher. This pattern is what you'd expect if the questionnaire is truly measuring affinity for EBP.
So it differentiates appropriately.
Right. And it also worked consistently for both CNAs and VTRNs on most items. That's called measurement invariance, and it means the questions are being understood and answered similarly by both groups, which makes comparing their scores meaningful.
Okay, so this sounds like a genuinely useful tool. What are the real-world takeaways? How can nursing homes use this?
Well, it gives them actual insight into how their CNAs and VTRNs see and potentially use EBP concepts in their daily work. Are they reflecting on care? Are they looking up protocols? Are they evaluating changes?
So it could highlight strengths and weaknesses.
Precisely. It can help nursing homes identify specific training needs. Maybe staff need more support finding protocols, or perhaps encouragement to discuss care improvements. It helps foster that culture of evidence-based care.
It empowers them to target their efforts.
Yes, but it's also important to remember, going back to those roles.
The doer, user, replicator.
Right. While this tool helps understand and support the users and replicators, the CNAs and VTRNs, you still really need those bachelor's level nurses, the potential doers in the mix to guide the critical appraisal side of EBP.
Makes sense. It's a team effort.
Absolutely. And organizational support, leadership buy-in, resources, time, that's still fundamental for any EBP initiative to succeed. This tool is part of the puzzle, not the whole solution.
No single tool ever is. But it sounds like a really valuable piece. A stepping stone, maybe, towards better care for frail elderly residents.
That's the hope. Better care, potentially better patient outcomes, maybe even reduced costs in the long run if care becomes more effective and efficient.
It really connects the dots. Okay, to wrap up, here's something to think about. What does measuring affinity, that liking and understanding for evidence-based practice, really mean for building a culture where people constantly learn and improve? Not just in nursing homes, but, well, anywhere. Professional work involves applying new knowledge. Think about it. How could insights like this drive change in your own field?